Hi guys, and welcome back to my channel. I am KD, the future WHNP, and by the title of this video, you guys can already see that I am done with WHNP school at Vanderbilt University. Yes, so I am done. I have my master's degree now. I'm done with this program, and it's now time to move forward to get ready for boards and to then try to find a job within this amazing specialty. So I know it's been a while because obviously life, I still work and like I say in school and things like that. So I know these videos are kind of far in between and I apologize, but it's life and that's what's going on right now. So I think I need to catch you guys up on what's been going on because I think I have to talk about the fifth semester and then this last semester. So let's go ahead and get into it. So in the fifth semester, again, this is a 6 semester, 2 full year program, part time women's health nurse practitioner at Vanderbilt that I am in. So the fifth semester, we had 2 classes. And the one class was a women's and gender related health for advanced practice nurses, 2. And that was 3 credit hours. And I don't know if I mentioned, but the fifth semester is when we started our clinical. So fifth semester and sixth semester, we have our clinicals. So that was one class, and then the second class was our practicum, which is our clinical, and that was 4 credit hours. So a total of 7 credit hours for the fifth semester. So in that first class, again, women's and gender related health for advanced practice nurses, 2, we had 4 exams in that class. We had to do 2 podcast reflections. So in a lot of the different courses that we have, they would also post podcasts that we could listen to just for more content and just to kind of help maybe on some topics that were a little difficult to just kind of help us maybe understand some topics, and we would have to watch a few of them and just give a reflection of what we learned, like a little outline of those podcasts. So we had to do 2 of those podcast reflections. We had a clinical peer activity that we had to do. So we had many different topics in women's and gender related health that we could choose from, and we had to do some kind of like clinical peer activity where we made like a flyer or a pamphlet or something to where other students, or even if we put it like in a clinic that patients could get and learn more about different topics. So I am a labor and delivery nurse, so I chose mine on fetal malposition, where I created basically a pamphlet on the different types of position that the fetus could be in utero, and the benefits or the risks of those different positions. So, is a certain fetal position favorable for a vaginal delivery, or is a certain fetal position going to lead you more towards a C-section? Are there any other risks that could come along with the fetus being in a certain position in utero, that could cause any issues or problems? So I made a nice pamphlet of that like again the other students could use to help study for our exams, and then if something I wanted to put, or maybe implement within our clinic, for maybe patients that we found that their fetus was going to be breech, frank breech, or a footling or something like that we could maybe give to them. And here's some more information on why maybe you're having certain issues or complications with this pregnancy, or why we are looking more towards doing a C-section because of the position of your baby. So that's what I created. And then we had a lot of block activities in participation. So we were not going to campus during the fifth semester. That was the fourth semester when we went to campus. So we did not have to go. I think we only went one time. Forgive me, I might be wrong. I think we went one time in the fifth semester. But other than that, they were all virtual. So you had to participate and be there because those were mandatory, obviously, and then do different participation things and different activities and stuff that we had. So you got graded, for those. And then the second class, like I said, was the practicum. So was your clinical. So for the fifth semester, we had to get a total of 280 clinical hours. And then within that time frame of the semester, we also had to get evals done by our preceptor. We would write a little something, about, our, how we thought things were going, what we liked, what we didn't like, whatever the case may be. And then our preceptor would write something as well. And then we had some different check boxes to see like how we were doing and were we up to par maybe on certain skills and things like that. So we had to get that done 3 times throughout the semester. And then we also had to hand in like our clinical hours, at certain points throughout the semester to show just that we're on task, we're on par with meeting the 280 before the semester ends. So that was the fifth semester. And then the sixth semester, which was the very last semester, so I just finished up, is again, we had two classes. So one class was called Advanced Practice Nursing in Primary Care of the Adolescent. That was just a 1 credit hour course. And then we had our second practicum course, which was 5 credit hours. So that was a total of 6 credit hours for the sixth semester. So in the primary care of the adolescent class, we had three quizzes. They called them quizzes. Us students, we would not have said that they were quizzes. We would call them exams and tests, but they called them quizzes. So we had three quizzes. We also had a health disparity quiz that we had to take about different types of health disparities throughout adolescence. And then we also had to do a reflection about different types of health disparities. So just pick a topic of, like, say, health disparity that adolescents could go through and just write a reflection on that. With the practicum course, again, that was 5 credit hours, and we had to do a total of 320 clinical hours in the sixth semester. So it was 280 in the fifth semester, 320 in the sixth semester. So that was a total of 600 clinical hours in the clinical setting with your preceptor. We also had to do 30 hours of board preparation. So we had whatever, book or whatever type of prep that you wanted. They gave us a big list of different things that we could purchase if we wanted to. So we just had to choose one. And we had to study for at least 30 hours and show that we studied for 30 hours doing prep for the boards with whatever the book or, whatever we may have purchased. We just had to show that we studied for 30 hours. So in total, with also our in-clinic clinical as well, and then with this study board prep, it was a total of 630 hours total that we had to show that we completed with our preceptor and then also studying for the boards. So again, 630 total hours. And that was it. That was the sixth semester. After that, and actually today is August the 5th, and on August the 3rd, just this past Saturday, is when we had our pinning ceremony. So I just went up to Vanderbilt to get pinned. And we all know, nurses, your pinning is the culmination of your program. It shows that you are done and you have completed everything. So I'm officially done with Women's Health Nurse Practitioner School. I got my pin, and oh my God, I also received an award at pinning as well. Totally unexpected. Was of course they didn't tell anybody, so you could truly be surprised. So every specialty, the faculty picks someone and they give out an award. So here's my award. I'll show you guys if you guys can see it. Yes, so it says, from Vanderbilt University School of Nursing recognizes Kevin Drayton as the Women's Health Gender-Related Nurse Practitioner Outstanding Student in the class of 2024. So I was so just honored and proud to be able to be recognized by just the staff for this award. As I've talked throughout this, it's just difficult being a male within this specialty, being a black male within this specialty. There are not a lot of people that look like me within this specialty. And it was tough even throughout clinical. I would have patients that, just didn't want a male, obviously, in women's services. So that was tough. And, even at work, I go to work and I'm a labor and delivery nurse, and I work with a certain population. I work at a county hospital where I think they are just so happy to receive care that if it's not for a cultural reason, I have not been turned away from any patient. But my clinical setting was a private office. So obviously these people get to choose, who they want to go to for their health care. And I would say I got turned away from a lot of patients. But I had a great preceptor who made sure that I got to see and do as much as a patient would allow me to do. And it was an amazing experience. But I knew walking into it that, I was not going to be able to go into every single room and see every single thing. And that was okay, because I know what I'm walking into. But to be recognized by my faculty and staff for just being a great student and throughout this program is just truly... I have no words, have absolutely no words, was not ready for that at all. But really just wanted to catch you guys up on that. I am done. So now the next step is getting ready for my boards. I'll be preparing for that, and then start really looking for a job. I also am going into the DNP program immediately after this is done. So I start the DNP program in about 3 weeks, right at the end of the month. That is a 5-semester program to get my doctorate and just move on and see, what comes of that. So I'll take you along again with that journey as I go throughout my doctorate and as I get ready for boards and as I pass boards, because I will pass, and start looking for a job within this women's health specialty. So thank you all for watching. Make sure you like, comment, and subscribe, and I'll see you guys in the next video.